Aloha, everyone. Welcome to Pre-Health Summer Game Plan Experience to Strengthen Your Path. My name is Dasha, and I'm one of the Pre-Health and Pre-Law advisors. I'll be your moderator for today's session. I'm also joined by Lauren, our senior peer advisor. She's going to help manage the chat and make sure things run really smooth. And today's session is all about giving you a glimpse into summer experiences that can strengthen your path to healthcare careers. We're going to go over international shadowing, community outreach opportunities. But before I begin, I just want to make sure that we go over some housekeeping notes. So please keep your microphone muted and feel free to leave your cameras off during the presentation. There will be no need for that. And then drop your questions in the chat at any time. Lauren and I will collect them for Q&A. And then we're going to be sticking to a time, kind of a strict timeline. So I want to make sure I keep things on track. I'm going to introduce each program and then our speakers will introduce themselves. So thanks again for joining. So the first program I want to introduce is COPE Scholars Hawaii. It's a community health and mentorship program where students work directly with underserved communities. It's a great way to build experience in health education services and leadership. I have today both Monica May and also Lay Medina, which is a student participant here to share their experiences with COPE. So I'm going to let Monica get us started off, and then, of course, Lay to share her experience as well. Thank you.
Okay, can everybody hear me?
Yes.
Okay. Okay, so hi everybody. My name is Monica. I'm with Cope Health Solutions with the Cope Health Scholars Program, and I'm the outreach coordinator. If you don't mind scanning this QR code to let our manager know that you've attended, we would really appreciate that so that we can send you more information in the future. If the QR code is um, kind of weird, I can send a link at the end of the presentation. And I'm representing the Cope Health Scholars Program at Adventist Health Castle. So the Cope Health Scholars Program is basically a clinical volunteer program at Adventist Health Castle, and we have a lot of pre-health students in the program because it provides a lot of clinical training and experience. And it's for students who look to provide hands-on patient care. On top of like pre-health students, we also have students who are just trying to figure out what they want to do in their life. So it kind of opens doors for them to kind of solidify what they want to do. So in the beginning of the program, you have to do 30 hours of training, and you are committed to do 280 volunteer hours. And this will earn you a certificate in patient experience and pre-licensed clinical care. And there's a bunch of different departments, special projects, and networking opportunities that's available with the Adventist Health Castle program. So this is just one success story. This is Kobe Young. He's a Cope Health Scholar alumni. He actually um, worked at the hospital during the same time he was a Cope Health Scholar, and it opened doors for him because it helped him get into medical school. So he just started medical school, and yeah, if you want to be more proactive, I think you should join. Um, Not only does the Cope Health Scholars Program help pre-meds, they also help with nursing students and pre-physician assistant students. So on the top we have Angelica, who is now comfortable working as a nurse, and we also have Peyton Miles, who just got accepted into a competitive PA school. And this is all because of the experience that was provided and probably the networking that they got and their letters of recommendations. So The Co-Health Scholars Program is located at Adventist Health Castle in Kailua, and there are about 300 physicians and more than 1,000 employees. So the at the hospital, there's a wide range of different services, including inpatient, outpatient, and home-based services and specialty care. But for the Co-Health Scholars Program, we don't really do much home-based services. And this is just an overview of how you can become a co Scholar. So, first you have to do an online application, an interview, pass the screening, and then there's training, quarterly department specific orientation and training, quarterly rotations. And in order to graduate, you need to reach a minimum of 280 hours as a health scholar, and at the end of the quarter, you get to get a certificate in patient experience and pre-licensed clinical care. So for enrollment and clearance, we want to ensure that you're at least 18 years old, you're in college, you pass the health screening, and there's also a background check. And it's required that you have health care insurance throughout the program just in case you get injured at the hospital. And here's just the different kinds of tracks. So there's a 15-month track, which requires 16 hours per month, a 9-month track, which requires 32 hours per month, and a 3-month track, which requires 80 hours per month. You also have to commit to quarterly program meetings and 280 hours to the program. And shifts can be done in either um, 4 hours a day or 8 hours a day at a time. Um, it's just that you have to take a break in between if you do take the 8 hour increments. And yeah. So again, for enrollment, you have to do an online application, a virtual interview, the health screening and clearance, and after that, you have just 1 day of training with the Co-Health Scholars Program. Um, so we focus a lot on didactic training and patient care stations to ensure that our patients are safe, healthy, and comfortable. But we also get tested on competency and department specific orientations. And the department specific orientation is necessary because the different departments in the hospital um, might have different things or they might have different organization um, standards. So it's very important that you also tour and do a competency checklist for the department you're training in. So here's just the training curriculum. So there's patient care competency, service excellence, rules and regulations, and leadership and management. And this training is going to be online on Canvas. So yeah. And as a health scholar, there are a lot of things that we can do, but there's also a lot of things we can't do. So we're able to greet and assist members and or visitors, round on patients, answer call lights, promote floor initiatives, discharge patients, ambulate non-fall risk patients, do vitals, feed patients, run labs, assist with daily care activities, and observe procedures or surgeries. Um, and for the restrictions, we are unable to translate or interpret clinical information, handle medications, and act as a sitter or ambulate fall risk patient members. So for the program experience, again, there's quarterly department specific orientation and training, quarterly rotations, a minimum of 280 hours of experience and the completion in pre-licensed clinical care and patient experience. Here's just the different departments that are offered at Adventist Health Castle Co-Health Scholars Program. So tier one is usually the departments you start with. So it'll be med surg and telemetry. And once you reach 48 hours, you're eligible to apply to work in the emergency department, imaging, the ICU, or mammography. And once you reach 96 hours, you get to enter the birth center, the behavioral health center. And there's an outpatient OBGYN clinic that's not at the hospital, but it's nearby. And the highest tier is the operating room and the post anesthetic care unit. Um, and from what I heard, tier four is really hard to get into because it really depends on your commitment to the program and the recommendations you get from the people that you shadow. So it's very important to not just have the co-pulse scholars in your resume, but actually build relationships and character so that you get more out of this program. On top of just shadowing and shifting and volunteering at the hospital, we also have a leadership team that you can join. We do community outreach, we do patient and staff interactions, and additional training opportunities. One thing I want to point out is we do have a service dog that comes around. So if you're feeling stressed, you can you can just talk to the service dog or pet the service dog, and the service dogs will give you hugs and kisses. And there's also additional training opportunities. So at Adventist Health Castle, they offer a lot of certifications. I know they have BLS and first aid and CPR, and we get the classes at a discounted rate. So I think it's $60 instead of when you pay for it like outside, it's $100 for the certificate. So I think that's really nice, getting a little bit of a discount. So again, the benefits of the Cope Health Scholars Program is eligibility for a letter of recommendation. You don't just get a letter of recommendation from the program manager. You can honestly get one from even the doctors you work with or the nurses that you work with because they work a lot closer to you than the program manager. You also get a completion certificate, access to educational events and workshops. There's 34,000 different alumni in the Cope Connect network, so you can also ask them questions or network through the website. And there's also access to Princeton Review materials. So our summer cohort 2 deadline was just extended for 2 more days. So there's still time to apply if this program interests you. There's also a fall cohort and a winter cohort. Um, Below is just the price of the the program. So if you want to do the 15-month program, it's $325. If you want to do the 9-month program, it's $475. And the 3-month program is $595 with an application fee of $21. For more information, you can visit this website. And again, if you don't mind scanning this QR code, we'd really appreciate that. Um, And here is our program manager and program assistant manager's contact information if you have any questions, but I can also answer any questions if anybody has anything.
Thank you, Monica. I'm gonna have them put the questions in chat right now until we'll hold to the end of Q&A, and then they can also unmute and ask questions as well. But I also wanted to bring in Lay Medina because she is currently in the Cope Scholars Program and has some fresh insight, and I would love for her to share her experience. And yeah, Lay, go ahead.
Hey guys, sorry, I know we have a couple minutes, but thank you so much for letting me join this call. My name is Lee, and I am a current COPE scholar, so I believe I have over 200 hours in the program, and I'm currently in the Behavioral Health Services Department. It's super fun. I really enjoy the experiences that I'm getting here. I really appreciate that Monica talked about Kobe, who I actually met the day he got accepted into medical school. He's really awesome, and it's those kind of opportunities that you really I don't think you can really get anywhere else. I also have a current shadowing opportunity that I got from meeting a doctor in the ER through this program, and so there's a lot of opportunities that you kind of wouldn't expect, but you would definitely probably appreciate through the program. And I think the biggest part of it is that you really get out of it what you put into it. I think that's probably the most important thing. So even if, you might feel like, oh, I'm not sure what I'm doing, ask. Or if you feel like, oh, I'm not sure if I'm getting the most I want to out of this program, go do more. See if what more there is you can do. And I think the most I feel like what I'm getting out of the COPE program is that I'm learning about how the hospital works together. So it's though I am a pre-med and I'm interested in pre-health, I'm learning about what nurses do. I'm learning about what the PA's role is, what NPs also do on the floors, and how that team works together. And that's a really valuable piece of information that you really can't just get from reading a book or just, talking to one person. It's really something that you get from doing that experience, being in that role. So I would definitely say if you guys get the opportunity, it's a really great investment and you can continue it for as long as you like. And it opens up a lot of doors for you after the program.
Thank you so much, Lee, because that is what we always talk about, right? Like being able to actually see it in practice versus assuming and reading. It's so much rich experience you get when you're actually on the floor and seeing how everything comes together. So thank you for sharing that experience. So
Can I also add something? Because I'm
yeah,
also a co-felt scholar myself. Um, so, um, those medical drama shows like Grey's Anatomy? It's nothing like that. Like, it's completely different. And I think like the coolest thing, um, like that is allowed with the program is that we're allowed to shadow the surgeries. Um, I don't know. It's really cool. If you're not into surgery, maybe you'll go into like a different part department in the co-pilot college program because there's imaging, there's I think there's administration. So yeah, there's a lot of different um ways you can um fit yourself into the program.
thank you so much. I'm glad you shared that because you're just kind of reading my mind as we are thinking about the next experience. I do want to talk about Texas State Peru. And this is an international shadowing opportunity that gives students firsthand exposure to healthcare delivery in Peru. And it's a great way to join a global perspective and cultural competencies. So the next you're going to hear from Kevin Briggs, who will walk us through what students can expect from the Texas Day Peru experience. But I'm sure Kevin can really talk about the surgery aspect of it. So without further ado, Kevin, take it away.
Well, thank you for having me. I really appreciate it. Let me share my screen right quick. There it is. There, are we sharing it?
Yep, we're sharing.
Okay, so let me add a little bit about me before we start. I'm Kevin Briggs. I'm the co-founder and the head of Texas de Peru, which is a medical surgical mission. We take teams of surgeons down to Peru every summer. Usually we have a cohort of about 25 or so. Take each mission week, lasts about a week, and we take care of patients and have a whole lot of fun doing it. Dasha, I'd like to ask you a question before I continue with the presentation.
Yeah, sure.
Have you ever been arrested in an international airport?
No, and I hope to never do so.
Have you ever come home from a trip overseas and found a box of morphine in your backpack?
Absolutely not.
Well, these mistakes I have made personally. If anybody ever wants to read about them, I've written a book about the founding of Texas de Peru, and you can find those stories in there. But I'll tell you, if it's okay, I'm going to deviate for just a little bit and talk about the founding of Texas Day Peru, because I think it's pertinent, not just from I want to be a career in health, but basically kind of getting up and doing what you need to do anyway. So the work that we do down in Peru, I don't know if you're familiar with the geography down there, but we're in the Andes. It's about 9,600 feet in altitude. And it's a little place called Coya in the Sacred Valley of the Incas. The Sacred Valley of the Incas, roughly speaking, is between Cusco and Machu Picchu. And Machu Picchu, as you probably know, is a World Heritage Site, a bucket list destination. Highly recommend, if it's not on your bucket list, put it on there. It's a place that I think everybody ought to see at least once in their lifetime. We work at a place called the Kasiwasi Clinic. And the Kasiwasi Clinic, I mean, we really couldn't do what we're doing unless we had the support of a clinic like that. The clinic sees about 30,000 patients for primary care every year, and they have a catchment area of about 2 million people in the area. About 46% of the population is designated below the poverty level. Although it's a real tourist area, there's still a whole ton of poor people there that need healthcare. And nobody at the Kasiwasi Clinic is turned away if they can't pay for healthcare. So we founded this thing about 15 years ago, maybe a little bit less than that. And part of the reason, this is one of my favorite pictures of myself. I think we all have favorite pictures of ourselves. You know, my hair looks pretty good there, but I'm all sweaty. I'm wearing leather gloves, man sweat. I've got a Texas A&M t-shirt, which implies that I'm well educated and manly. So this picture was taken of me when I was in Joplin, Missouri. And the reason I deviate for just a second to tell you about this, Joplin, Missouri, about 15 years ago was totally ravaged by a tornado. 155 people were killed. It's like a giant lawnmower 1 mile wide mowed down the whole town. And when we got there, I went there to do some volunteer work with a church I was going to, and sleeping on the floors in the youth group and all that stuff. But I noticed something there. This is after FEMA has come and gone, after the National Guard has come and gone. There are people that are showing up in town with a back seat full of water, or a back seat of car full of canned goods, or blankets, or something. And I saw that hundreds of times over and over again, where people basically do what they could to help for a day and then go home. Do what they could to help for a day and come home. None of these people have been trained. None of these people have any credentials. None of these people have lots and lots of initials at the end of their names, like all of your students will eventually. And that's kind of the point. There's so much that we as individuals can do if we just get up off the couch and go do it. We don't have to be qualified. There's never enough qualification. There's plenty of excuses why we shouldn't do something. There's a whole lot of things that we can do if we just simply get up and go. There's another picture of Joplin there, just terribly torn up there. So as naturally as one would think, once seeing this horrific thing in Joplin, we did what anybody would naturally do. We buy a llama suit. I mean, who doesn't have one, right? Has anybody heard of the term, the story about stone soup? So basically, one other thing that I'll leave you before I start talking about the missions is, my slide deck is giving me fits. Sorry about that. So basically, the story of stone soup is basically two beggars come into town, and they don't have any food, or they don't have any money, but they do have a pot, and they basically set up shop in the middle of the town, put a big rock in the thing, and start stirring it. And people would come by and say, "Hey, what are you doing?" And they would say, "I'm making stone soup. And you're welcome to come and join us for dinner later on tonight. By the way, do you have any potatoes?" And before long, the whole town is coming to dinner, and everybody's bringing a little something. The point is, things like this, visions that are worth doing, that help other people, that are a lot of fun, are like big exercises of stone soup. And if the vision is good enough, inviting others to come aboard, that makes all the difference. So unqualified people like me can invite doctors and nurses and CRNAs and PAs and nurse practitioners and RNs, and it finally comes together. So let me talk a little bit about the missions themselves. And this is just driving me nuts. Let me get out of presentation mode. Can you still see the slide deck? All right, sorry about that. So the missions themselves, when we're down there, like I said, typically speaking, we'll see about 200 to 300 patients per week. Typically speaking, the clinic will curate patients of a particular disease state or specialty. For my missions, we take orthopedic surgeons down and gynecological surgeons down. We don't do any OB. The clinic used to do OB, and we're going to be doing OB in the future. But for right now, we're just doing gynecology. So we'll do about 200 to 300 patients per week. And I don't know if you can see that line there. The first time we went there, we showed up at the clinic at 6 o'clock in the morning, and there were 200 people waiting around the clinic, and the first ones arrived at 2 o'clock in the morning. By the way, it gets awfully cold at night there. It's in the high 30s at night because we're at about 9,600 feet in altitude. So tons of people there. We do our missions from dawn to dusk, and we occasionally have emergency walk-ins, but it's mostly for the specific specialty that we're treating there. Typically speaking, we'll leave Dallas or you leave the States on a Friday. We'll start learning to breathe. We'll arrive at the clinic on a Saturday, start learning to breathe again, unpacking all of our gear. We'll start doing our surgeries on Sunday morning, and then we'll do surgery Sunday, Monday, Tuesday, Wednesday, Thursday. Friday, our teams go to Machu Picchu for a little tourism, and then go to Cusco on Saturday, and then make our way back home to the States. Here's one of my favorite doctors, Dr. Ted Crum, one of our patients there. So a typical day there, we'll get up at 6 o'clock in the morning and we'll have a team breakfast. And we all have breakfast as a team. We have lunch as a team. We have dinner as a team. We'll walk over to the clinic. Our guest house is probably about 5 blocks away from the clinic. We try to get to the clinic before the administrator of the clinic gets there because we want to make a good showing of ourselves. We'll have a staff review of the patients that were there the night before and the procedures that we anticipate doing that day and what the patient volume is going to look like. Typically speaking, we'll try to knock out about 5:30 or 6 o'clock and then return to the guest house and then repeat it again the next day. Really don't want to burn people out too much because it is a little bit stressful on the body being at high altitude for those of us who have a lot of gray hair. And there are stomach bugs that, inevitably we kind of pick up. By the way, the doctor on the left there delivered my daughter via emergency C-section. So she always gets to come on the trip, and I'm happy to have her. So an optimal team will look something like this. We'll have about 15 total clinical personnel. A perfect team would be 4 surgeons, so I can rotate them in and out. We've got 2 ORs in the building, and you can see one of them there. It's kind of rudimentary. We have anesthesia towers, we have lighting, we have tables, we have suction, we have Bovie, and we have I'm forgetting a couple other things. But pretty much everything else that we need to do surgeries, our instruments, our disposables, our drapes, gloves and gowns and suture, we're bringing everything with us. So typically a typical team will have about 4 surgeons on it. We'll have 2 to 3 anesthesiologists will come, 2 or 3 CRNAs, and we'll have scrub tracks are just absolutely golden and valuable for us. Folks can basically float between the OR and sterilization are critically valuable. And then we'll have RNs for the PACU as well. We also have PAs that come with us and nurse practitioners. Typically speaking, we'll loan them to the clinic and let them see primary care or emergencies as they come in. And we typically kind of divide the clinic in half. Our side of the building is for the surgeries, and then the other side of the building is for others. And then we've always had, in the last 13 years or so, we've always had pre-health students go with us, but we haven't had a formal program per se. This last year, we turned it into a formal program where we're basically rotating the students into surgical rotations, office visit rotations, orderly rotations, sterilization rotations. Typically speaking, our students typically get to see 4 or 5 surgical procedures. They get to see about 10 to 15 office visits. It's more, sometimes more, but they typically glove and gown, but they stand in the corner. They're not licensed to do anything else. The doctors are awfully good about answering questions as they come up from the students, and I was really pleasantly surprised how much the doctors really enjoy doing it. For them, they feel like they're making better doctors, and for them also. And I don't know how many are thinking in these terms, but if you're going into medicine just because it's a great income, you need another reason. It's a calling, it's a vocation, and that's one thing about job shadowing. It's one way to find out if it's a vocation or not. But our doctors really feel like they're making better doctors in the round now. So 3 takeaways from this in general, and I'll kind of wrap up, and I can share more slides if you like. Even if you're not going into medicine, I mean, I don't have a clinical background. My background's healthcare IT. If you want to talk about the future of AI in healthcare, I'm a good guy to talk to about that. But as far as procedures, I'm not your guy. But I do have the skills to evaluate talent and attract talented people to my mission and to my vision. So my suggestions for you, if you don't have a passion project, find one. Join somebody else's. If you need one, I've got one. You're welcome to join. Happy to have all the help we can get on that. But passion projects are rocket fuel for your life, and they're rocket fuel for your career. Second, if your dream is big enough, there's room for everybody on board. A good rule of thumb is my dream helping people, and is it fun? If that's the case, you probably got a good vision. And then the third thing is nobody's ever qualified enough, and nobody's ever found the perfect time to do anything. I have a friend who's more than qualified. He wants to go badly, and for 10 years, he just can't break away because the timing's not right. Friends, the timing is never right, and you're never qualified. Go anyway. Go anyway. So the next step from my standpoint in terms of the motivational speech part of this thing, it's up to you. I highly recommend finding your own passion project. If you can't find your own, latch onto somebody else's. And if you can't latch onto somebody else's, latch onto ours. And I thank you so much for letting me share a little bit about what we do. I'm happy to do Q&A. So anyway, mahalo nui loa. I really appreciate you letting me talk about our program. Thank you so much.
Thank you. Thank you both. So now we're at the point now where we can definitely open it up for questions. You guys can feel free to drop your questions in the chat, or if you want to unmute, we can do that as well. Laura and I will look at the chats to see if there's any questions, but if you want to unmute and ask, go for it.
What is the cost of the Texas de Peru program?
We've been charging our students this year $5,000, well, $4,999. In our program, it covers the lodging, covers the food, covers all the transportation, and we also do scholarships for the nurses and medical supplies and medication.
Hey, Kevin, do you have a picture of the lodge?
Yeah, let me share
I just
again.
thought about that so that people can see where they're going to be staying and you can speak a little bit more. Meanwhile, anybody else have any other question that they want to ask while he?
Let's see. Bear with me a second. Let's see.
See if I see any other.
Oops.
I know I just threw that one at you, didn't I? So you threw a curveball.
No, that's all right. That's all right. This is kind of a Peruvian Ronald McDonald house. It's a bunkhouse where family can stay with their loved ones while they're getting care.
Nice. And then you guys go
Um,
back and do your breakfast there as well? Is that where you go and you
well,
go?
we have a breakfast at the house. You know what? I don't have it in this deck. I'm sorry.
It's okay. It's actually on your website. So you might want to also just share the website as well if you want to drop that in there.
Yeah, I can do that.
Yeah.
This is in my other presentation, which is delightful. It's really
There's a lot of information out there. And also what I found interesting is all the doctor experiences and the things that they shared um
yep.
on your website. So definitely check it out. Kevin, you want to share that? And then also, I mean, I guess my question too would be, what type of students do you typically see? I mean, I know we talk about pre-med, but you also had mentioned, I think before we talked, you mentioned you have PAs that come for the shadowing as well as APRNs and DEMPs. So I'm just wanting to,
So on the actual treatment of patients front, we can take PAs and nurse practitioners, et cetera. Anybody that's licensed. Nobody that's licensed is delivering healthcare. So, you know, they'll let me in the OR, but only to be a hug pillow, you know, when they're getting a spinal. Um, but as far as the students are concerned, most of our students are pre-med. We do have some other pre-health careers type students, but the vast majority of them are pre-med.
okay. And I do have a question for you, Monica. Based off of your experience, because you did mention, right, you actually are a co-student or graduate. You're doing it now, or you did it before?
I'm doing both. So I'm in the program, but I also applied to be in a leadership position, which is the outreach coordinator.
Well, congratulations on that.
Thank you.
What advice do you have to students who are unsure about like community work? Actually can go for both of you because you guys are both doing community work, but just curious to know like if you have any advice for any of the students.
Um, for me personally, I think I think if you go into medicine, like you have to um have some type of empathy. And I live all the way in Waipahu, and driving all the way Kailua is I hate driving. But I always think about like, there's people that need help. There's people that are counting on me. So I just think of it like that. We're put into this position for a reason, and yeah, I want to make use of it. So yeah.
I appreciate that you shared that too about the drive because I do have students that ask. Cope Scholars is a pretty um, popular program that we even list on our website. And one of the things that we talk about is the location, right? And I know that Lee had to go, but that was one of the things she mentioned too. She mentioned she had quite a bit of a commute, but it was so well worth it. But you're right, you have to be motivated, and that yes, that goes into my other question, like what motivated you to even get involved in Cope? Like how has it helped you grow?
I'm gonna be honest. I had a friend who was in the Copilot Scholars Program, and she just got accepted to medical school like a year ago, and she told me like, what kind of 20-year-old have you heard of that has like scrubbed into surgeries and shadowed surgeries? And I was like, you know what? Yeah, that's a really big deal for me. And I don't know, I just wanted to like open doors for myself. But yeah, the surgeries are cool. Everything else is cool about the program.
I'm glad you speak it. I mean, it's interesting. We have two people that are passionate about the surgery side of things. So
Hey, Monica,
okay,
you said something that you said one of my favorite words, empathy. And you know, even if you're a doctor or not, empathy is a superpower in my mind. If you understand people and understand what makes them tick, you can help them. And I've been in healthcare IT for a long time, working with a lot of doctors, good and bad. And the ones that are empathetic souls make better doctors. Period. The ones that aren't, I'd really rather not have them as my doctor. You know, um, but empathy to my thinking is a superpower, you know, in business and in life in general. So I'm glad you said that. Thank you so much.
Thank you. I agree. Are there any questions right now that I am? Oh, okay. I see a question out here. There's one for Cope. When is a good time to apply relative to your college timeline?
Um, I would just say apply anytime because there's two summer cohorts, there's a fall cohort, there's a spring cohort, and there's a winter cohort. I would apply it ASAP because it opens doors. A lot of the Copelt scholars get jobs from being a Copelt scholar because they're familiar with the hospital and they've already shadowed the procedures and stuff, so they kind of know what goes on. So if you start your freshman year, you can probably get a job by, I don't know, maybe your sophomore year, your junior year, and you'll just gain a lot more clinical hours um, for whatever graduate school you want to apply to. And then there's another question. There is no specific classes or training that you have to do before the COPE program. We provide all the training that you need. And again, if you need help with anything, there's nurses and doctors that you can ask. So yeah.
And then I guess that would actually make me ask another question for Kevin. Is there a specific um, level of classes that students would need to apply for the shadowing opportunity for Texas State Peru?
Not per se. I mean, as the program matures, we'll probably be a bit more exclusive than we are right now. Really and truly, what we're looking for in the students is the right attitude. Um, our patient care comes first, and before anything else, we're a medical surgical mission. This is not spring break. Uh, we don't. We really can't afford to have people that aren't serious about being down there. Don't get me wrong, we have a great time. We really do. But there's not a specific class requirement. The reality is you need the job shadowing hours, no matter how many hours you already have in school. I don't know about your school, but some of the schools here in North Texas do offer some internship hours as part of it. Um, I don't know that that's consistent across the board, though.
Yeah, I know that Texas has does things a little bit different, but every
Oh,
school
Texas does a lot of things a little
yeah.
bit different.
But everything, but every school
That's
has
good and bad, but
So I'm looking, I don't see any more questions in the Q&A chat. Does anyone have any questions that they want to ask with the unmuted? Okay. What I would like to do, first of all, I want to thank you both for joining us today, but I also wanted to make sure that everyone knew that they can definitely meet with us if you want to learn about more experiences and opportunities. We do have, obviously, if you've been to our PAC website, tons of information about that as well. And Lauren actually is sharing the screen with you right now. Thanks, Lauren. And so we do have more workshops coming up. So definitely if you want to schedule, I know some of you guys were just reaching out to us, but yeah, definitely scan the QR code and make sure that you guys are registered for the next ones coming up. And then also feel free to um, sign up for our social media. We're on Instagram, we're on Facebook. We have a lot of new information, so you definitely want to stay up to date with all of our latest opportunities. And again, too, if you want to spend some one-on-one time planning and looking at some more of those opportunities, please do schedule an appointment with myself or any of our peer advisors. And I just want to say thank you so much for joining us. Thank you guys, both Monica and Kevin. And I know Leia's gone, but just really thank you guys so much for joining us and giving us more information and letting our students know about all the opportunities that are available to them.